Can you just update us on this first fatality of West Nile?
Yes, so we're reporting our first West Nile virus fatality in a Midland resident this year. This will be our first West Nile virus death in a Midland County resident in the last decade.
I just want to remind people just how common it is that most people who have it and they don't develop symptoms.
Yeah, so most people that get West Nile virus, about 80% of them won't develop any symptoms at all. They won't know they have it. Those that do develop symptoms, most of them are minor, things like fever, headache, nausea, vomiting, stiffness of neck and joint pain. But in rare situations, patients can progress to more severe illness, including things like paralysis or swelling around the brain and the spinal cord that can lead to death.
And how common is it, someone getting the West Nile virus, during this time of year in the fall?
So we typically see the most West Nile virus cases in Texas in August and September. And so this, we're kind of coming out of the peak season, but that's typically when we're seeing most of the human cases.
I mean, like you said, 80% of people who do contract it, it's not fatal. It's just, would this person just had underlying conditions that have gone along with this? Yeah,
so most of the people that do develop severe illness and die do have underlying health conditions or are immunocompromised in some way. I won't speak to this patient specifically just for privacy reasons, but in most situations where patients die, they do have underlying health conditions.
And then do you know if the patient was transported somewhere else and they passed away, or was it here in Midland?
I wouldn't like to disclose that just because that information could help identify the patient, so we'll just not speak to that.
And just so what do you want to say to some Midland residents just to not worry and not have a panic about this whole thing?
Yeah, it's still a good idea. I mean, it's still warm outside today and will continue to be, as we know, through November. We continue our mosquito surveillance efforts through the end of November. And so while most human cases happen in August and September, they can happen here in October and in November. So continue when you're outside to take those precautions like wearing long sleeve shirts, pants. Using mosquito spray definitely is one of the best things that you can do. Dump standing water if we get any rain. And so continue to take those precautions even though it's not peak mosquito season.
Is it necessarily right to assume that the first person that tested for West Nile and Midland County, that this is the same person?
Okay, yes, so this is not the same person as our first case. This is a different individual.